Welcome back. Dr. Randy Young joins us now. Doctor, how long has Penn State Health been using this telehealth EICU system?
The project's been in the planning stages for 4 or 5 years now. There really was a long ramp-up time to get everything up and running, but we've been actively monitoring patients for just over 2 years, and we've had physicians in our own hub active for about the last 6 to 9 months.
Well, talking about that hub, is there a doctor or nurse there all the time, 24 hours?
Our efforts are principally focused at night when the density of nurses and physicians actually on the ground drops a little bit, especially in some of the smaller hospitals with which we're affiliated. But yes, we've got nursing monitoring and physicians available whenever necessary, but as I mentioned, most of that is focused on the nighttime.
How does the system work?
Well, it's really pretty neat, and I think a lot of us are very pleased at how well it's worked out. We have lots of mechanisms for communicating with people at the bedside, both telephonically and with high quality audiovisual systems. We also get direct data feeds from the patient's bedside, so we can get information about their heart rhythms, their blood pressure, their ventilator parameters, and so forth. So it's really like being as close to the bedside as you can be without actually being there.
It's quite remarkable. Who thought maybe like 20 years ago this would ever be possible?
It's come a long way.
It really is. Who do you think benefits most from this telehealth EICU?
Well, I think the system is really ideally designed to benefit patients in hospitals that might not have 24/7 intensive care physician presence. And a big hospital like Hershey, we really are pretty well staffed 24/7. But in smaller hospitals, even within our own health system, even within the Harrisburg metropolitan area, we can provide a benefit to those patients, I think, without question. And that will only expand as we move forward.
We'll talk about that expansion. I mean, do you hope to add this health system to all patient rooms or most patient rooms?
I think it'll certainly be in all the higher acuity areas, the intensive care units, of which we have 6 or 7 different types, in our step down or intermediate care areas. Exactly what role it'll play in a routine patient room or a post-op room is hard to say. The emergency department's another place where there may be a real role for it.
Is it exciting to you?
It is exciting. It's I've been in medicine a long time, and I've seen lots of advancements, but this has been one of the most fun, and I think potentially one of the more impactful.
Really, really impactful. So to be able to see like a Penn State Health expert who's not physically right there in the room with you, to have access to that expertise is tremendous.
We hope we're helping.
Tremendous. Thank you so much, Dr.
Thank
Young.
you.
Well, up next on Good Day PA, more from our viewers and our experts who are participating in today's ABC 27 telehealth web chat. Remember, that chat is happening now. It continues until 11. We'll be right back.